sexually transmitted disease. You may hear the term STI instead of an STD, as in sexually transmitted infection. They mean the same thing. One of the names of the STDs such as chlamydia, gonorrhea, syphilis, trichomoniasis, human papillomavirus, herpes, HIV, hepatitis B, and pubic lice. STDs with occur bacterial like syphilis, gonorrhea, and chlamydia. STDs with occur parasitic include trichomoniasis and pubic lice. Viral STDs include HIV, herpes, hepatitis B, and HPV. Viral STDs do not have a cure. Symptoms of STDs can include abnormal discharge and bleeding from genitals of infected body part, pain, fever, swelling and tenderness, frequent urination, itching and burning in the infected area, burns, bumps, rashes, and oozing sores, which can be itchy, sore, and painful. The most common symptoms is no symptoms at all. The majority of people who contract an STD will never experience symptoms, while they experience symptoms so mild that they go unnoticed. You cannot tell just by looking at the person whether or not they have an STD. While external symptoms are possible, every person's body responds to STD differently. This is important because even if a person is not having symptoms, STDs can still be causing damage to the reproductive system. The only way to know if you have an STD is to get tested. How can someone contract an STD? STDs spread through vaginal, anal, and oral sex. Other ways STDs can be transmitted are from mother to child during pregnancy or childbirth, blood contracted through needles or syringe, skin-to-skin contact with the infected body part. This does not cause HIV. And here is special note on HIV. HIV stands for Human Immunodeficiency Virus. HIV is a virus that can be sexually transmitted. When a person becomes infected with HIV, the white blood cell count is reduced and immune system is compromised. If left untreated, HIV can develop into AIDS, and a person cannot have AIDS without first contracting HIV. HIV can be transmitted to the following bodily fluids: blood, semen, vaginal fluids, and breast milk. This means that the only HIV can be transmitted to vaginal, anal, and oral sex, but the disease can also be transmitted through childbirth, breastfeeding, or by shedding needle. When a person contracts HIV, their bodies begin to produce a specific type of antibody. HIV is not contained in saliva, meaning HIV cannot be transmitted through kissing. However, HIV antibodies can be found in saliva. The oral rapid test can be used to detect HIV. It can up to 3 months after a person contracts HIV for the antibody count to be elevated enough to show up on the test. This means high-risk individuals should be getting tested every 3 and 6 months.
Anyone can get an STD. There are diseases that are spread primarily through sexual contact. Teens and young people are affected by STDs more than any other age group. According to Center for Disease Control Health of the 19 million new STD cases in year occur in youth ages 15 to 24. How can a person avoid getting an STD? Not engaging in sexual activity that puts them at risk, which includes vaginal, anal, and oral sex.
Let's review. We know how STDs are transmitted. We know the signs and symptoms of an STD infection. We know some STDs don't have symptoms. We know how to avoid getting an STD. But why would we want to avoid getting an STD? Emotional consequences of STDs could include feeling sad, angry, confused, embarrassed, afraid, and depressed. Anyone engaged in sexual behavior can be at risk for contracting STD. It does not mean that they are bad or dirty person. Treatment with antibiotics will cure a bacterial STD, but any damage are already done to the body cannot be reversed. Bacterial or parasitic STDs can be cured. Viral STD are not curable, but there are medications to make the symptoms more manageable. HPV and hepatitis B both have preventive vaccination. They can help develop immunes. You can talk to physicians to learn more about the vaccinations. Free already cost testing and treatment and available at your local health department. A special note on HPV is a group of more than 150 related viruses. HPV can transmit it through skin and skin contact. For most people, HPV will clear up on its own within about 2 years. STDs making you more vulnerable to HIV. Having an STD makes you 2 to 5 times more likely to contract HIV through sex. You often can tell a person has an STD just by looking at them. STD are sexist women are twice as likely to catch them than men. Many STDs are not curable, but they are always preventable. Getting tested and having all of your partners getting tested will help reduce the risk of STD, including HIV. Condoms can also help reduce the risk of STD, including HIV, but remember that risk reduction is very different from risk avoidance. Abstinence is the only 1% effective way to avoid the spread of STDs. Remember, you can avoid STD but stay away from behavior that will put you at risk. Thank you.